4-hour walkout, many services likely to be disrupted, although urgent and emergency care should not be affected.
Ministers have expressed their disappointment at the strike. Here's our health correspondent, Dominic Hughes.
Across the health service in England and Northern Ireland, there is growing anger over pay. After 2 years of a salary freeze, staff in England were told they would get a 1% rise. But that doesn't apply to those eligible for automatic increases that reflect skills and experience, called increments.
This is the first time in 133 years that our members have been balloted and are taking industrial action. But also it's significant for the NHS as well, because this is not something that occurs by any means regularly.
Ministers say they're disappointed the strike is going ahead. A statement from the Department of Health in England said, NHS staff are our greatest asset, and we've increased the NHS budget to pay for over 12,500 more clinical staff since 2010. We cannot afford a pay rise in addition to increments, which disproportionately reward the highest earners without risking frontline jobs. Staff in Scotland did get an across-the-board 1% pay rise. In Wales, some unions are balloting their members. But in England, and to a more limited extent Northern Ireland, there will be 5 days of coordinated action. The union stress they want to convey the anger of their members, not disrupt the care of patients. But some services will be affected. Dominic Hughes, BBC News.
Well, let's get a little bit more right now from Dominic, who's at Manchester Royal Infirmary for us this morning. Morning to you, and how are services there likely to be affected? Morning.
Good morning. Well, some services here will be affected, but of course they're stressing that patient safety will not be put at risk. If you're coming in for a serious operation, life-threatening procedures, A&E all open. Women giving birth won't be affected, but some antenatal and postnatal classes, for example, might be cancelled. But let's talk to a couple of the pickets here at this lively picket of the outside central Manchester. Val and June, what are you guys after? Why are you here today?
We're after fair pay, because at the end of the day, you know, we work really hard. We're trying to struggle to make a living. You know, prices have gone up. Food, shopping, you name it, and we're just struggling on every day. You know, we do our best, we come to work, we work hard, and we want a decent pay rise, you know, 1%. And some people haven't got 1%, people that are at the top of the bands, that they obviously get it, but people that are going through increments, they don't get it. They work hard to get their increments, and we're entitled to fair pay. The government get their pay, why can't we get ours?
June, what about you? Obviously, there's some real anger amongst health workers today.
Well, exactly what Val said. You know, we work hard. We deserve, you know, fair pay. You know, we deserve this rise. We do work hard. You know, the government needs to see that, you know, we're struggling.
What about those people who are worried about the issue of what will happen to patients today?
Well, you know, patients will be looked after, you know, but obviously we're not there, you know, so there will be a bit short-staffed and, you know, people will struggle, you know. It just means that more, you know, a lot more qualified staff will have to get, you know.
Can I just say, the unions have made sure there's cover always,
cover.
and patient care comes first, and that's what it's about. At the end of the day, any emergency service is always covered, and the unions talk with the trust, and they talk with the trust to make sure that a cover is provided.
That's great. I think people will be reassured by that. So if you have a GP appointment today, for example, you probably won't be affected. GP surgeries are working normally, but it's the sort of planned stuff that is going to be affected today. Emergency services working as normal. Back to you.
Okay, thank you very much. Thanks very much. We'll be speaking to the Health Secretary about 7:40 here on Breakfast. Also the General Secretary of Unison from a London picket line in around 10 minutes' time. New measures are to be introduced to deal with the risk of Ebola to Britain.